I was having some periodontal issues, the typical little bit of gum bleeding and so forth like that. And the dentist that I was seeing at the time in Florida was a friend of the family's who referred me to a periodontist that was there in Jacksonville, who ended up evaluating my situation and found that I was beginning of bone loss. They did the old style of surgery whereby they flip back the gums and they do the scraping process, and the recovery time is insane when you do it that way. And it helped for a little while, but it was definitely not a long range treatment option for me at the time. And my periodontal problem was continuing to the point that I was starting to lose a front tooth, and it was becoming more and more loose. And the tooth was actually, I could see it when I would smile. The tooth was progressively getting lower and lower to the point where it became loose enough that after being up here, I had to go to a dentist near Blairsville, my hometown, and have the tooth removed. At the time, he evaluated my periodontal condition and made a suggestion of referral to Dr. Codelli. And so with Dr. Codelli, I started the options there. Dr. Codelli's approach was, you don't need your teeth removed. We just need to be able to save your teeth, save the teeth by restoring the gums, restoring the bone. And his approach to the overall, my overall periodontal situation was what I was looking for. And, you're hoping that what's being said can come true, but, there's always a little bit of skepticism. That's probably my background as an engineer, Will it work? And I got to tell you, almost a year and 3 months into it now, my bones are solid as a rock. All my teeth are tight. They do a process, I'm not sure exactly what it's called, but they measure the pocket. And I had pockets that were like 7 and 8 and some 9s. And through LANAP, where it stimulates the bone growth, and by killing back the periodontal disease, I mean, some of these 7s and 8s are down to 3 and 4s. So it's remarkable what it can do. And for me, what I found is that comparatively what they wanted to replace all my teeth for, cost-wise, what I've spent to take care of my teeth, it's a long-range approach and will stay with me, it's a fraction of the cost. And now that they've found that there's a big correlation between periodontal disease and poor glucose control, A1C numbering, that's been a phenomenon. I brought that approach and information to my endocrinologist, of which he's just now hearing of it as well. And I will say that since I've had this treatment, my A1C has dropped 0.4 points, which for me is insane. I mean, maybe I'd gain, I'd drop maybe 1 point, maybe sometimes 2 points or whatever, but never a 4-point change in a 6-month period. So it's definitely affecting not just my overall dental health, but it's affecting my diabetes control to a much better point in my life. So it's making a big difference.